So, today's topic is Zika virus infections. Zika virus disease is an emerging viral disease and it is transmitted through the bite of infected Aedes mosquito. It has potential of international spread because of wide geographical distribution of vectors, lack of immunity among population in newly affected areas, and high volume of international travel. The infection during pregnancy can cause certain birth defects such as microcephaly, that is a condition defined by small head and brain damage, along with other defects like blindness, deafness, seizures, and other congenital defects. There is an increased risk of neurological complications and it is associated in adults and children, including Guillain-Barré syndrome, neuropathy, and myelitis. There is no vaccine or medicine for Zika till date. WHO has declared Zika virus disease to a public health emergency of international concern, that is PHEIC, on 1st February 2016. Now comes to the history. Zika virus got its name from the Zika forest in Uganda, Africa, where it was first identified in 1947 in monkeys through a network that monitored yellow fever. It was later identified in humans in 1952 in Uganda and the United Republic of Tanzania. From the 1960s to 1980s, human infections were found across the Africa and Asia, typically accompanied by mild illness. The first large outbreak caused by Zika infections were reported from the island of Riep in 2007. Brazil reported its association with the Guillain-Barré syndrome and with microcephaly in 2015. Now, Zika virus in India. The first outbreak was reported in Ahmedabad in January 2017 and the second in Tamil Nadu, Krishnagiri district in 2017. Both these outbreaks were successfully contained through the intensive surveillance and vector management. In late 2018, large outbreak took place in Rajasthan and Madhya Pradesh, where 159 and 127 cases were reported respectively. Now, in 2021, cases are reported from Kerala and Pune, Maharashtra. Why Zika virus outbreak is alarming? Because it is associated with microcephaly in newborn child delivered from mother with history of Zika virus infection during pregnancy. Now comes to the epidemiology. Regarding the agent factor, it is a single-stranded RNA virus which belongs to genus Flavivirus and family Flaviviridae. It is closely related to dengue, yellow fever, Japanese encephalitis, and West Nile fever. Regarding host factor, all age groups and both sexes are affected, and reservoir of infection is not known till date. And once a person has been infected, he or she is likely to be protected lifelong. Now, vector profile. Aedes aegypti and Aedes albopictus are the main vectors. However, Aedes hanseri was the predominant vector species identified in the Yep outbreak. Now, some habits of the vector. Feeding habit. It is a day biter, mainly feed on the human being on domestic and peri-domestic situation and bites repeatedly. Resting habit. It rests in the dark corners of the houses, on hanging objects like clothes, umbrella, etc., or under the furnitures. Breeding habit. Breeds it in any type of artificial or man-made containers or storage containers having even a small quantity of water. Eggs of Aedes can survive without water for more than 1 year. Now regarding transmission, transmission occur mainly through the mosquito bites from a pregnant woman to her fetus, through sex, laboratory exposure, through blood transfusion. Zika virus has been detected in breast milk, There is no reports of transmission of Zika virus infection through the breastfeeding. So, based on the available evidence, the benefit of breastfeeding outweigh the possible risk. Now, incubation period and viremia. Incubation period, basically there are few reports uh, that says that the spread of Zika virus through infection through infected blood and semen. However, the claim still need to be validated. Now, regarding incubation and viremia, the incubation period of Zika virus disease is not clear yet, but it is estimated to be 3 to 14 days as per WHO, and it may be extended to few weeks. Zika viremia ranges from few days to 1 week. Some infected pregnant women can have evidence of Zika virus in their blood longer than expected, and the virus remains in semen and urine longer than in blood. The extrinsic incubation period is 5 to 10 days. Now comes to the symptom. As another viral disease, many infections are asymptomatic. About one case out of 5 are only present with symptoms. So only 20% will present with symptoms. They will have only mild symptoms such as acute onset of fever, maculopapular rashes, headache, joint pain, conjunctivitis, and muscle pain. Symptoms last several days to a week. People usually don't get sick enough to go to the hospital, and fatality is very rare. This is pictorial representation of symptoms. Now this chart show the comparison of Zika, dengue and chikungunya. All three viruses can cause fever, rash, arthralgia, headache and myalgia. But Zika can cause conjunctivitis and dengue can cause hemorrhage and shock. Now, as it shows mild symptom, then what is the need for diagnosis? Due to increase in global travel, Zika virus may spread, and so preparedness for dealing with these agents is therefore vital. As once infection is transmitted, there is a possibility of establishment of disease. This would also help in early identification of suspected Zika virus infection and help to adopt suitable measure for prevention and control of Zika virus. Now, Zika virus testing should be done for anyone with possible Zika virus exposure. Possible Zika virus exposure include living in, traveling to or having unprotected sex with someone who lives in or travel to an area with risk of Zika. So, anyone with possible Zika virus exposure who has or recently experienced symptom of Zika. Symptomatic pregnant woman with possible Zika virus exposure, or asymptomatic pregnant woman with possible Zika virus exposure, or who have a fetus with ultrasound finding consistent with congenital Zika virus infections. Now, testing strategy. As per WHO, RT-PCR in the patient presenting with onset of symptom less than 7 days, serology or nucleic acid test in patient presenting with onset of symptom more than or equal to 7 days. Serology is the preferred method in specimen from patient with onset of symptom more than 7 days. Recommended serological assay include enzyme immunoassay and immunofluorescent assay, which detecting IgM antibodies. Wherever possible, paired serum specimen should be collected at least 2 to 3 weeks apart, ideally with the first serum specimen collected during the first 5 days of illness. Now, there is a problem of serological cross reaction with other flavivirus. Zika virus serology that detect IgM antibody can be possible due to the antibodies against the related flavivirus, such as in case of dengue and yellow fever. Neutralizing antibody test by plaque reduction neutralization test may discriminate between the cross-reacting antibodies in primary flavivirus infections. Now, testing for infants, CDC recommend that the laboratory testing for all infants born to the mother with laboratory evidence of possible Zika virus infection during pregnancy, or infant who have abnormal clinical or neuroimaging findings suggestive of congenital Zika syndrome, and a mother with a possible exposure to Zika virus regardless of the maternal Zika virus testing result. Infant samples of Zika virus testing should be collected ideally within the first 2 days of life. If testing is performed later, then it is very difficult to distinguish between congenital, perinatal or postnatal infections. Now, laboratory support in India. National Center of Disease Control, that is NCDC Delhi, and National Institute of Virology Pune have the capacity to provide laboratory diagnosis of Zika virus disease in acute febrile stage and would be the apex laboratory to support the outbreak investigation. There are additional 10 laboratories would be strengthened by ICMR to expand the scope of laboratory diagnosis. However, RT-PCR test would remain the standard test in India. Now, reporting of Zika cases. Zika virus disease is a nationally notifiable disease. All confirmed cases should be notified to nodal office. India's Health Ministry appointed NCDC as the nodal agency for investigation of outbreak. Now, for notification, there should be some standard case definition. So, suspected case is defined as patient with skin rash or elevation of body temperature, that is low grade fever, that is less than 101 degree Fahrenheit, with one or more of the following symptom: arthralgia or myalgia, non-purulent conjunctivitis, headache or malaise, with a history of travel of countries with indigenous transmission of Zika virus infection in last 2 weeks, and confirmed case, that is a suspected case with laboratory positive result for RT-PCR for specific detection of Zika virus by RT-PCR. Now, Zika and pregnancy. Zika virus infection during pregnancy is a cause of microcephaly and other severe birth defect. All infants born to mother with laboratory evidence of Zika infection during pregnancy should receive a comprehensive physical examination. Congenital Zika syndrome is a distinct pattern of birth defect among fetus and infant infected before birth. Now, what are different features of congenital Zika syndrome? That is associated with 5 types of birth defects: severe microcephaly, decreased brain tissue, damage to back of eye with a specific pattern of scarring and increased pigment, limited range of joint movement such as joint motion such as clubfoot, and too much muscle tone restricting body movement soon after birth. Now, what is case definition of microcephaly? Microcephaly is defined as head circumference at birth is less than 3rd percentile for the gestational age and sex. If head circumference at birth is not available, then head circumference less than 3rd percentile for age and sex within first 6 weeks of life. At the time of birth, head circumference is normally 35 centimeter. Now, how to measure head circumference for microcephaly? Use a measuring tape that cannot be stretched. Securely wrap the tape around the widest possible circumference of the head, broadest part of the forehead, above eyebrow, above the ears, and most prominent part of back of the head. Take the measurement 3 times and select the largest measurement to the nearest 0.1 centimeter. Optimal measurement within 24 hours after birth. No reports of infant getting Zika through the breastfeeding. and there is no evidence that previous infection will affect future pregnancies. It is very interesting that not every infection will lead to birth defect. It is important to remember that even in places with Zika, women are delivering infant that appears to be healthy. So there are many questions remain about the timings, absolute risk, and the spectrum of outcome associated with Zika virus infection during the pregnancy. Infant of mothers with potential maternal exposure to Zika. Infant born to potential exposed mother who were not tested before delivery or who were tested outside the recommended window and the IgM result was negative should receive comprehensive assessment including a physical examination, careful measurement of the head circumference, head ultrasound to assess the brain structure, and standard newborn screening. Infection control in healthcare setting. Standard precautions should be used to protect healthcare personnel from all infectious disease. Transmission include Zika virus. That is, body fluid have been implicated in transmission of Zika virus. Occupational exposure that requires evaluation include percutaneous exposure or exposure of non-intact skin or mucous membrane to any of the following: blood, body fluid, secretion, and excretion. Now comes to the treatment. Treating patient who test positive, there is no vaccine or medicine, so treat the symptom of Zika. Symptomatic treatment is rest, drink fluid, plenty of fluid to prevent dehydration, and take PCM to reduce the fever and pain. And do not take aspirin and other non-steroid anti-inflammatory drugs until dengue can be ruled out to reduce the risk of bleeding. Protect from mosquito bite during the first week of illness when Zika virus can be found in blood. The infected mosquito can spread the virus to other peoples. The mainstay of prevention and control is avoiding mosquito bites by adopting personal protective measures including use of protecting clothes, mosquito repellent, eliminating household Aedes mosquito breeding site, integrated vector management including chemical, biological and environmental control, and improving community awareness by effective IEC. Now, integrated vector control is defined as a rational decision making process for the optimal use of resources for vector control. It includes 5 key elements, that is evidence based decision making, integrated approach, collaboration of health with other sectors, advocacy, social mobilization, and legislation and capacity building. First is personal protective measures. Second, biological control, use of larvivorous fish, etc. Chemical control, environmental management and source reduction methods, health education and community participation. Now, what is the WHO response about the Zika virus? WHO is reporting countries to control the Zika virus disease through defined and prioritized research into Zika virus disease by convening experts and partners. It enhances surveillance and potential complication, strengthen the capacity in risk communication to help countries meeting their commitment under the international health regulations. It provides training on clinical management, diagnosis and vector control, strengthen the capacity of laboratories to detect the virus. Now, as per the prevalence and incidence, WHO has classified area in different categories. Category 1 are defined as area with new introduction or reintroduction with ongoing transmission. Category 2 is area either with evidence of virus circulation before 2015 or area with ongoing transmission, that is no longer in a new or reintroduction phase but where there is no evidence of interruption. Category 3, area with interrupted transmission and with potential for future transmission. Category 4, area with establishment competent vector but No non-documented past or current transmission. These are the references, and thank you.